Unique, New York. We're good to go.
We're good to go.
We're good then. So we're good.
You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. Dudum. This is Back at It with Dr. Decompression.
Hi, Dr. Dudum. This is the Back at It with Dr. Decompression podcast. Thanks for tuning in. Thanks for listening. Last episode, we talked about my story and uncovering why I specialize in non-surgical spinal decompression and how it's helped me and how it's helped me with my leg pain and my sciatica. Today, I want to talk about what is sciatica. We're going to uncover sciatica. Before you get into the episode, don't forget, if you like what you're listening to subscribe to our podcast and subscribe to our YouTube channel. So don't forget to hit that button. Let's talk about sciatica. We're going to go over what are the symptoms. For me, it was frustrating because I couldn't walk. I couldn't be with my family. We'll talk about some frustrations that are common. We'll discuss the causes. There's 2 or 3 main causes that we're going to display and talk about. The key to getting to fixing it is getting to the root cause, and how do we identify the cause. So we'll go over those tips, and then discussing and showing some exercises that you can start today that may give you some relief based on the cause of your sciatica. Lastly, we'll talk about how I help people with sciatica in the clinical setting. That's what we're going to talk about today. So let's dive in. Frustrations and symptoms. It's typically back, but most importantly, it's leg pain. It's usually one leg. So it's going to be down the butt, down the back of the leg, and all the way into the calf or into the foot. Sometimes the toes. So butt, down the back of the leg. It is not on the front of the leg. It's on the back of the leg, calf, back of the foot. And the sciatica is a term that it affects the sciatic nerve. That's a branch or a bundle of nerves that go down that area. So the symptoms can be wide ranged. It's not just pain. Think of the nerve as a rope. So if I have a rope, and this is the rope has many different threads on it. Each thread does different things. So you're going to get maybe pins and needles, numbness, loss of sensation, pain, weakness. Any type of neurological sign could be sciatica. It's not just pain. So that's a big tip. The frustrations, you're going to get anything from weakness when you're walking, extremely sharp pain, you can't walk. When you sit, your leg is on fire. One telltale sign is it feels like you got kicked in the butt or shot in the butt. Your butt muscle, called the piriformis muscle, it could just be on fire. Another tell sign. What's causing it? What's actually happening? Let's break down the anatomy of the sciatic nerve. For our audio listeners, I'm showing a model of the spine, and I'll describe it as I show the video. Imagine we have 2 blocks. That would be the 2 bones in the lower part of the spine. In between the 2 blocks, again, for the audio listeners, think of it as a jelly-filled donut in the middle of the blocks. It's really just the cushion. It's the shock absorber of the 2 blocks, or the spine. Now, in the back of those blocks, that's where the nerve lives. And what can happen is that nerve goes down the back of the leg to the butt to the foot. That's the sciatic nerve. So audio listeners, the 2 blocks in the middle is the disc, that's a jelly-filled donut, and then the nerve runs behind it. And that nerve is like a cord or a thread. One of the most common causes that we'll see is the jelly there will squirt out a little bit. So if I squeeze the blocks too hard and there's too much compression there, the jelly or the donut will ooze and it'll touch the nerve. That would be a herniated disc. There's compression on the blocks. I squeeze the block squeezes the disc or the jelly-filled donut in this example, and it hits that nerve behind it. That's going to cause a lot of pain. Herniated disc, it triggers the nerve pain, and you've got pain, numbness, weakness, pins and needles down your leg. Again, back of the leg into the calf. The other cause could be, it's called piriformis syndrome. So most of us have heard of piriformis syndrome. Again, if you haven't, it's that one of the butt muscles. It's deep in the middle of your butt cheek. Some people, their sciatic nerve runs through that muscle. And if that muscle contracts or gets too tight, it could pinch the nerve. The symptom for that would be your butt is on fire and you have a stabbing pain in your butt with that radicular or pain down the back of your leg. So think of it. You're not having any back pain. You've got really bad butt pain all the way down to your foot. The stretch to figure that out, if it's piriformis syndrome, I want you to do a figure 4 stretch. Or I just want you to lay on your back. And if my left butt cheek is the leg that hurts, I'm going to lift my left leg over my right side. Now, if that causes sharp butt pain and a zing down your leg, there's a good chance that it's from the piriformis muscle. It's not from a herniated disc. This is not 100% true. Don't take me for 100%. It's just a good rule of thumb to help figure out what's causing your problem. Lastly, the other issue that could be going on is an irritation of the nerve by the little hole that the nerve comes out. So for the audio listeners, imagine if I'm putting my finger, and I make a circle with my thumb and my index finger. I make a circle and I put my finger through there. That's the nerve that goes through the hole that goes down your leg, through the bones. If I squeeze that finger and I make the hole smaller and I'm squeezing it, that would be an irritation or a pinched nerve. That can happen. It could be a disc, herniated disc. It's more common that it's a different type of arthritis or an inflammatory condition, or it could be a misalignment of the spine that's irritating it, or a posture misalignment. Those are really the 3 biggest examples. We've got herniated disc, most common. That was mine. You've got piriformis syndrome, which is the butt muscle. And then you've got number 3, which is the closing of the hole, which could be arthritis, or it could be a poor posture, structural misalignment. The key to this whole thing, which we're unveiling, is you have to get to the right diagnosis and find the cause of your problem. For me, 3.5 years ago, I knew my leg was on fire. I felt it. If you're listening and you have it, you know it's there. Which one of the 3 is it? I got an MRI. The MRI is, again, when you lay in the tube and it takes a bunch of photographs. An MRI is different. Let's break this down. An MRI is different than an X-ray. How is it different? An X-ray is a static. You stand, you take a film. It shows these black and white pictures. It's only showing bones. So it's going to show alignment issues of the pelvis or the lower lumbar spine. It's not going to show anything relating to soft tissue. Well, the number 1 cause of sciatica is a disc bulge. A disc is a soft tissue. So in order to diagnose that, we would need an MRI. We get so many patients in our office that are looking for help, and they quote that they've been diagnosed with a disc bulge. Okay. How did you come to this conclusion? I got an X-ray. So They really haven't been diagnosed yet because you cannot diagnose a disc bulge based on an x-ray. Just knowing that and knowing we need an MRI so we can figure out, is there a disc bulge? Which type of disc bulge is there? Where's the location of the disc bulge? How big is it? That helps us not only treat you effectively, but it sets expectations. So we can tell you, when are you going to be able to go on a walk again? When can you go play with your grandchildren again? When can you play basketball again? Diagnosis and expectations is what that would do. I just kind of went on a tangent. Sorry, some of these clinical pearls will pop up when I'm just thinking of things like this. So back to the agenda on the Back at It podcast with Dr. Decompression. Thanks again for listening. The MRI is going to tell us if it's a disc bulge. Most of the time in the office when we send people for an MRI, it confirms they have a disc bulge. It's the number one cause. Number two, the piriformis. If you do that stretch, and again, laying on your back, bringing your left leg over your right, so your left leg to your right side, if it lights you up, it could be your piriformis. So doing muscle work in there would be really good. Massaging it, getting we use Hypervolt or Hyperice. We love that company, Hyperice. We use their Hypervolt. It's like a massage gun. You can use that. Use the massage gun at home. See if that helps. Do a figure 4 stretch. So sit down in a chair. Cross, if it's your left leg, cross your left leg over your right leg. If you can push a little bit to get a stretch without causing the pain, continue to do that for 30 seconds. Keep doing that a few times a day and don't let it trigger the pain. If it helps, keep doing it. It's a good rule of thumb for exercises or stretches. Stretch until you feel pain. You shouldn't be stretching through the pain. Lastly, how would you diagnose a postural misalignment where that hole, remember, again, for the audio listeners, that hole with your fingers, and you put your finger, that's the hole where the nerve comes through. If that's a postural issue, that would be something we want to take an x-ray of. We want to check the alignment of the spine, the pelvis, the L4 and the L5, the two joints where the nerve of the sciatic nerve that it runs through. If those are misaligned and there's no disc bulge, that's the cause of the sciatica. Stretching to figure out if it's your piriformis, MRI to confirm if it's a herniated disc, and then x-ray to see the postural change. We talked about the piriformis and the stretching, and if that's a causation and you can figure that out at home, fantastic. How would you know if you have a disc bulge at home? Are you ready? Do you have a problem putting on your socks or shoes in the morning? If you do, you probably have a disc bulge. If you sit for periods of time and you get up from a sitting position, so sitting to standing, and that either causes a sharp, deep, sharp pain in your back, or that lights you up down your leg, you probably have a disc bulge. Those are two huge signs. The reason for the shoes, which is an interesting one, which I would say 90% of the patients I see cannot put their shoes on. So when you go to put your shoes on, you flex into a position. And for our audio listeners, again, when you're flexing, you're sitting and you're leaning forward. That's a flexing position. Bringing your chest to your knees is flexion. That will stretch the spinal cord. If the spinal cord or the nerve is irritated, it will light up the nerve. It's an orthopedic test that we do in the office. It's called a straight leg raise. That will confirm with pretty good certainty that you have a disc bulge. So, can't put your socks or shoes on, lights you up. Sharp, stabbing pain. I'm not talking about an ache. I'm talking about a knife stabbing pain in the dead center of your back. That's what we're talking about. That's how you're going to figure out if you probably have a disc bulge. pelvic alignment, piriformis syndrome, disc bulge. So now, what do you do about it? What do you do about the sciatica? Well, if you've got piriformis syndrome, meaning your butt or your glutes tight, like we said, use the massage gun, see if it helps. Do some very light figure 4 stretching, see if that helps. If it continues to help, keep doing it. Opening that muscle fiber, or opening up those muscle fibers will really help open up the piriformis and release that sag nerve. If you have a disc bulge, you think you do, a few things you can try. Number one, it's called the McKenzie protocol. It typically works very good. You can Google it, McKenzie protocol. The McKenzie protocol is fantastic for helping a lot of disc bulges. It doesn't help all disc bulges, but it's a great place to start. So one of the best exercises I like, it's called the Cobra. So what you're going to do is you're going to lay flat on your stomach, and our goal is to extend the back. What does that mean? That means that we're going backwards. We're not flexing to touch our toes. We're doing the opposite, going backwards. So you're going to lay face down. You're going to put pressure on the floor, and you're going to slowly lift up about 3 to 4 inches. And you're going to hold it for about 10 seconds. If this causes you pain and it continues to get worse, stop doing it. Again, that's a great rule of thumb for any stretch. The pain increases, it's not tolerable, stop. Try to do that. 10 seconds, 10 repetitions, a few times a day. What you'll notice, if it's beneficial for you, when you go only 3 to 4 inches and you're noticing it's getting a little better, try to go 6 inches. Try to keep extending back and back. If it's working for you, that means that the disc bulge is reabsorbing and going back, which is taking pressure off the nerve. Again, not for everyone, but try it. And if you're getting relief, continue to try it. There are more programs and steps to that protocol. That's a great place to start. The other exercise I love initially is called the cat-cow. Okay, you're going to be on all fours on the ground, and you're going to flex and extend your upper back. If you follow us on YouTube, the handle's at Dr. Dudum. We have a wide range of exercises and videos that you can watch if you need more description, or again, if you're an audio listener. So the cat-cow is a great exercise to do. Start that. See if it opens up your L4, L5, or L5S1 and takes pressure off the nerve. The key indicator is, are you getting less pain down your leg? So that's a phenomenon that's called retracing. It means as the nerve heals, the pain will retrace or centralize to the source and cause of the pain, which is your low back or lumbar spine. You want to pay attention if that pain is going from your toes to your knee or from your calf to your hip. It should be coming up. That's the key to healing. If the pain ever descends, meaning it goes from your calf to your foot, that would be it's getting worse. So you definitely would want to talk to someone about that. Those are great tips to start at home, and those can help you distinguish the path that you'd want to take to find help or to continue the relief. And that's how we help people every day with sciatica in our office. We utilize the non-surgical spinal decompression tables to help people with herniated discs. So if you think you have a herniated disc, or you're trying the protocol, it's helping, you want more, or it's not helping, it's just a place to start, I encourage you to reach out. You can email us, you can follow us on all the socials, and I encourage you to subscribe to the podcast. We connect with people all over the country, and we help patients not only in Walnut Creek, California, where our main office is located, but I help people remote all over the country and even parts of the world. So if you're looking for more help with your sciatica, or you're wondering what the next step is, please contact my office, connect with us through social. I'd love to talk to you further about how we can help you. This is episode 4, Sciatica Uncovered. Please subscribe to the podcast because next episode, episode 5, we are going to rip the curtain off of non-surgical spinal decompression. We're going to show the magic of how those tables work. So subscribe. Can't wait to talk to you about non-surgical spinal decompression in episode 5. Thanks for listening.